Assalamu alaikum. Hello, namaste, durud, hi, how are you? I came back again today to talk about our previous topic and content. Thank you for sharing our everyday class with your friend. Thank you for your support and subscribing us in our YouTube channel in Lily Mom Center LMC. So I love your messages, your direct message that you send to us. I love to know that what you like to learn. As I know, most of you midwife from all parts of the world, you have fantastic experience according your place and your native midwifery. And I'm trying to go through some evidence-based studies and share my experience and knowledge from Asian countries, some European countries, and some other called midwifery in those cultures, what works or I got experience about that. We spoke about antenatal classes, how to start, how to manage, how to make it attractive. Now we want to talk about how we start antenatal checkup and for starting the prenatal visit. Some of you are just nurse midwife, some of you are master of midwifery, and some of you are PhD in midwifery. That I receive many messages from you, and I love it when I see that with different midwifery degree you are joining us in everyday class. So I love to invite you to come and share your experience and your practice in your country. If you like, you can send your request and we will talk about that to arrange a live interview to hear from you as well. In antenatal classes, the most important issue that most of us we are first engaging with that is about booking visit for mothers. We have some initial assessment and some objectives in our initial assessment that we have to consider. Even we are as a community midwife, if we are as an individual midwife or I am, any kind of midwifery job description we have, we should know how to start this initial assessment. The first important thing is about how to start a foundation with trust relationship between mother and their partner with us. It is a skill and it is one of the important role of midwife to know how to make this communication and how to start this trusting relationship. I know most of you has passed many courses in management, behavioral management and social skills, how to start and how to build this trust. The most important thing that we have to think is about how to get history. As you know, in all level of midwifery, in midwifery process or even gynecology or family health, you should know how to get these details in history, because we should offer appropriate screening test. Until we don't get proper with details from their history, we cannot suggest with a screening test is appropriate for them. Sometimes they have some special complication that they need for especially referral, or maybe they need some extra screening test. It's very important. We have to spend time to observe and can make many very close communication to the mother, that she can open all of her history with detail for you. Sometimes even the mother is not that much happy to share all of her history, and sometimes even maybe they don't remember in that time, but their family and the partner that who's sitting with you and she make this trust relation with you, they can concern about those worriness, those fears, and those previous history. To ascertain baseline, recording of blood pressure, urine analysis, blood values, uterine growth, and fetal development should be used as a standard for comparison as the pregnancy progresses. And to identify these risk factors, we have to be very, very accurate to find the details of her past and her present midwifery, obstetric, medical, family, and personal history. It's not just sitting and just filling the forms until, okay, it's finished, I got all of the history. No. Some of the details and some of the questions that we are asking maybe is not that much clear for mother. Maybe sometimes we are using some medical terms and abbreviations that the mother doesn't understand. We have to be sure that she got our point and she understands what is our meaning about. And this is how, through the way of open answering question, it's made to provide an opportunity for the woman and her family to express and discuss any concern they might have about a current pregnancy or previous pregnancy, loss, labor, birth, and puerperio. It is very nice opportunity for us to do this, collecting this family history details. We can start to make this relation and start open conversation that build the trust communication between midwife and mother and family. The other things, it's we have to be careful how to go through referral, appropriate referral, because according to the details and the history that we are collecting from mother, we can find that a special appropriate referral that needed for this mother. Maybe they need some special healthcare support, or maybe they need some special referral concern. Yeah, some factors are very important. Some factors need a special and additional antenatal support and referral. In many diseases and many history that they give you from their obstetrical, physical, or other health concern, you can find. You can find through the initial assessment and checkup. The first thing that you have to consider is about the age of the mother. Mothers less than 18 years, and in some countries more than 35 years, or some countries more than 40 years. It depends. It depends to your country policy. For example, some countries, they consider less than 18 years and over 35 years. For example, in UK, it is 18 years and above 40 years. So this age need some special and some referral to doctors, physicians, and obstetrician. The other important things is grand multiparity. Why for grand multiparity we have to have a special concern for referral for obstetrician? Yeah, because sometimes, you know, all of you know, with some mothers that they have grand multiparity, they are overweight, they have some special mental or physical health issue. Some of them, because of their previous surgery, maybe they have some placenta increta, placenta accreta. Sometimes we have precipitated labor with this mother. We have different issue that multigravida mother, they will face with that. You as a midwife know how much they can be complicated. Some of them, they will get GDM on diet, GDM on insulin. That is a very big issue about these mothers. Sometimes they have pendulate abdomen, pendulate belly, that make a malposition and malpresentation for the baby inside. Sometimes we have a big size baby. That is some concern that we have to take care of that. Plus many other issues that it happened for multi-gravity mother. The other important initial assessment that we have to consider for additional antenatal support or referral for obstetrician and physician is about the mothers that we have unknown and uncertain expected date of birth. Because some of them, they have irregular menstrual cycle. They don't know exactly what time it was their last menstrual cycle, and sometimes they have some other gynecological complication that they cannot remember how their menstrual cycle was happening. They don't know exactly about the date of last menstrual cycle, or they had, for example, breakthrough bleeding, or they have oligomenorrhea, polymenorrhea, short cycle. So their gestational age is not that much accurate, so we cannot give them very certain expected date of the birth. For these, we have to refer them to obstetrician for some ultrasound or some checkup to see and give us exact date of pregnancy. And the other important things is late booking. The mothers who comes to us with late booking, it means that she's not going through proper antenatal care and checkup. So maybe she hasn't done her lab screening test. Maybe we don't know exactly what is her past history, and maybe she doesn't get enough care about the others' complication. So these mothers, if they are coming in the late booking to you, you have to care about her as the additional antenatal support service. What about past obstetric history? Which past obstetric history we have to consider for additional antenatal support by doctors? Yeah, something you are remembering. Something like a stillbirth, past history of neonatal death. Why is important? What is the reason? A stillbirth, maybe there was some congenital problem for the baby, or maybe she has some insufficient uterus and genital organs, blood circulation, or some abnormality in their pregnancy process. Or if they have some neonatal death, we have to check if the previous baby, they had some genetic disorders, malformation, maternal malformation, and or maybe they have some heart or some deficient problem in that baby. So we have to care about the newborn baby. What was the reason? It is maternal reason or it is fetus reason. The other important history that we have to care about that is the congenital abnormality plus. Sometimes we have some mother that they have reduced immunization, and the mother who had history of PIH, pregnancy-induced hypertension, because it may happen again in this pregnancy. We have to consider if she has this previous history. And the mothers who has 2 or more termination of pregnancy. What does it mean, termination of pregnancy? If she has 2 or 3 most probably she should have some problem and some complication that maybe happen again in this pregnancy. Termination of pregnancy because of many reasons can happen. And which week of pregnancy they decided to terminate her pregnancy. It's very important. The other important thing is if the mother has 3 or more spontaneous miscarriage. Why for 2 or 3 spontaneous miscarriage we should be careful? Yeah, there is some reason, because maybe she will go for precipitate labor. Maybe her cervix is not that much strong to hold the baby in the eldest age of the pregnancy. Maybe they have to go to the obstetrician to try for the to provide them circulation to keep her pregnancy longer and prevent miscarriage. And sometimes they need some medication like progesterone and some proton ampule to give them till 28 weeks of pregnancy to reduce incident and risk of miscarriage and abortion. And the mothers with previous preterm labor. Previous preterm labor can happen again in this pregnancy. Preterm labor happen because of many reasons. Can be because of some fetus reason, or can be because of mother uterus dysfunction. So it can happen again in this pregnancy. So they have to go under referral. And other important past obstetrical history is if mother had cervical circulation in past or present pregnancy. Because if she has circulation in this pregnancy, we have to consider if she gets contraction, we have to remove this circulation. Otherwise, it will tear the cervix. So they need some special care from gynecologists, and if they have previous circulation, because again in this pregnancy maybe they have improper supported cervix, maybe they need again for circulation operation again. And the other things is the mothers who has previous cesarean section or uterine surgery, because if they have one cesarean section, it's okay, we can strive for them for VBAC. With 2 cesarean section, we should have more precaution about that. And if they have cesarean section plus other uterine surgery, we have to consider many other issues. First is like VBAC. Second things, maybe they will have some placenta increta and accreta, and we have to go through a special ultrasound for them. So we have to refer them to the obstetrician. The other thing that is very important is antepartum or postpartum hemorrhage. If they have history of anti or postpartum hemorrhage, we have to consider that, because there should be some blood complication. Maybe they are anemia, maybe they need some blood reserve, Paxil, maybe they need some special treatment before pregnancy, and some maybe special care in the hospital at the time of the birth. So we have to send and refer them to the health professions. And the last 2 things can be precipitate labor, that is very important for us, and another one is multiple pregnancy, that we have to refer them to obstetrician to have a special care as well. And about maternal health, that the history of DVT, deep vein thrombosis, or pulmonary embolism is very important, and chronic illness like epilepsy, asthma, hepatic, and other issue. As you know, we have many other diseases like hypertension, like GDM on insulin, uterus anomalies, history of infertility, and cardiac diseases, family history of genetic disorders, and type 1 or type 2 diabetics in maternal health, some substance abuse, psychological or psychiatric disorder, they are the important issue about maternal health that we have to refer them to obstetrician. And some things that is as an examination at the initial assessment we should consider. If you find, for example, blood pressure more than 140/90, or if you find mother very obese and overweight according her BMI and blood disorders. So these are the most important issue that we have to consider. These factors may require additional antenatal support, or we have to refer to an obstetrician, physician, or health professional. Thank you so much for spending your time with me. I love it to hear from you. Thank you for your support. And if you like these classes, please share with your friends and follow us in YouTube channel Lily Mom Center LMC. Please press the bell and subscribe us. Thank you so much. If you don't mind, I want to talk some words in Persian for my Persian and Farsi language midwife. Thank you so much. You are bearing with me. سلام دوستان عزیزم، شبتون بخیر. امیدوارم که در مباحث قبلی که خدمتتون بودیم مطالب مفید واقع بوده باشه براتون. همکاران عزیز ماماهای فارسی زبانم، ایرانی و افغانم، تاجیکم که امیدوارم از این مباحث استفاده تونسته باشیم ببریم. مباحثی که ما صحبت کردیم امروز مباحثی هستش که در رابطه با اولین چک‌ها و ویزیت‌هایی هست که یه مادر پیش یک ماما میاد. همونطور که خودتون همه این مراحل رو داشتین و خیلی توش حاضر هستین، فقط برای یادآوری ما یه سری مطالبی رو با هم شیر میکنیم. یکی از این مواردها این هستش که ما اول بتونیم یک پل ارتباطی مطمئن و اعتماد سازنده رو با مادر و ماما ایجاد کنیم. یعنی ما باید اول یک ارتباط عاطفی و ارتباط مبتنی بر اعتماد رو بتونیم در مادر ایجاد کنیم تا بتونه تمام جزئیات و دیتیل و ریز سلامتش و سابقه بیماری هاش رو بتونه با ما به راحتی در میان بذاره و ما بتونیم از این طریق به مادر کمک کنیم که بتونه اون تست های غربالگری لازم رو، تست های آزمایشگاهی لازم رو بر اساس نیازش بتونه دریافت بکنه. مورد بعدی ما باید بتونیم یک سابقه ای از فشار خونش، از آزمایشات خون و ادرار و رشد بچهش و حتی در رابطه با شرایط پیشرفت بارداریش رو بتونیم هر جلسه، مخصوصا در جلسه اول داشته باشیم. و بعد اینکه ریسک فاکتورهایی رو که میتونه در گذشته و حال مادر وجود داشته باشه، چه به عنوان یک تاریخچه بارداری، مامایی، زنان، پزشکی، خانوادگی رو ازش حتما بتونیم جمع کنیم. یعنی یک هیستوری کامل از این مادر باید در جلسه اول داشته باشیم. همچنین ما باید بتونیم این شرایط رو ایجاد کنیم و این فرصت رو براش ایجاد بکنیم برای مادر و خانواده‌اش که بتونن راحت با ما در میون بذارن اون نگرانی هایی که و مسائل مهمی رو که براشون در ارتباط با بارداری گذشته و بارداری الان مطرح هست رو با ما شیر کنن، به ما بگن و راحت بیان کنن. و موارد دیگه این هست که ما بتونیم اون بهداشت عمومی رو جوری برای این مادر و خانواده‌اش آموزش بدیم که اینها بتونن به راحتی اون رو انجام بدن در این بارداری و در نتیجه در زندگی آینده این خانم. و مورد دیگه این که ما باید بدونیم کدوم یک از این مادران رو باید تو سیستم ریفرالمون قرار بدیم و برای گرفتن یک سری سرویس های ویژه بفرستیم. خودتون میدونید یک سری مادرها هستن که تو این شرایط ها اگر این فاکتورها رو درشون ببینیم باید اینها رو ما تحت سرویس یک متخصص هم قرار بدیم. مثل در اولین اسسمنت های اولیه چیزی که هست سن مادر هست. مادر زیر 18 سال و بالای 40 سال مادرهای پرخطرن. پس اینها باید یک حمایتگر دیگه در تیم براشون بذاریم. دوم، خانم هایی که حاملگی های گرند مولتی پریتی دارن، حاملگی های بالای سه بارداری رو داشتن، اینها جزء عوامل پرخطر و نیاز به یک حتما ساپورت پزشکی دارن. و در کنارش خانمی که خونریزی واژینال داره در هر سنی از حاملگی، یا اینکه هنوز از تاریخ زایمانش مطمئن نیست، یعنی نه تاریخچه پریودش رو میدونه نه تاریخ دقیق بارداریش رو، اما باید اینو دقیقاً بتونیم بفرستیم، یا آلتراساوند بکنه، سونوگرافی بکنه، ببینیم دقیقاً این چون شاید پریودش منظم نبوده هنوز نمیتونه از خودش یک تاریخچه درستی رو در اختیار ما قرار بده. و مورد دیگه لیت بوکینگ هست. مادری که دیر میاد برای مراقبت‌های بارداری یه خورده بعد بیشتر روش دقت داشته باشیم، چون ممکنه که یک سری کامپلیکیشن ها داشته باشه که توی مدت هیچ پزشکی نرفته، کنترل نشده و خیلی ممکنه خطرات آتی و جدید رو داشته باشه. اما مورد دیگه پس obstetric history هست، یعنی اون تاریخچه بارداری گذشته مادر رو پذیر رو کنیم، بگردیم چیا هستش. یکیش میتونه داشتن یک بچه مرده باشه، یک استیلبرت باشه، یا اینکه یک مرگ نوزاد باشه. موردی که مادری که با بچه کوچیک یا بچه بزرگ هست، مادری که یک بچه ناهنجار داره یا داشته، خانمی که واکسیناسیون رزوس داشته جدیدن، یا خانمی که PIH داشته، سابقه حاملگی فشار خون بارداری داشته، یا حاملگی 2 تا یا بیشتر ختم بارداری داشته، یا بیشتر از 2 تا سقط خود به خود داشته، مادرهایی که سابقه زایمانهای زودرس رو دارن، مادرهایی که سرکولاژ داشتن و یا الان تو این بارداری میخوان سرکولاژ بشن، باید بشن، خانم‌های با سابقه سزارین قبلی یا جراحی‌های رحم، همچنین اونهایی که خونریزی‌های قبل از زایمان، دوران بارداری یا بعد از زایمان داشتن و زایمان‌های پرسیپیتیت و ناگهانی و حاملگی‌های چند و اما در تو با ماترنال هلتش، مواردی هایی که در ماترنال هلت یک مادر خیلی مهم هست باید در نظر بدیم، داشتن سابقه دیویتی قبلی بوده اگر داشته، یا اینکه بیماری های کرونیک و مزمن مثلا سر داشته، یا آسم داره، یا هپاتیت داره، یا بیماری های عروقی و قلبی، یا سیستیک فیبروزیس داره، یا اینکه مشکلات رنال و ریوی داره. همچنین خانم هایی که در ماترنال هلتشون سابقه فشار خون دارن، یا نازایی، یا ناهنجاری های رحم هستش، سابقه دیابت، فشار خون و دیابت تایپ 1 و 2 خیلی مهم هستش، و همچنین مصرف دارو و یا الکل و مادرهایی که همچنین اینها دیزوردر و اختلالات روانی و روان پزشکی دارن. و اگر ما در زمانی که مادر مراجعه میکنه در اولین مراجعه دیدیم فشار خون مادر بالای 14 روی 9 هست، این رو بلافاصله باید بذاریم رو همون گروه خاص و در کنارش خانم های چاق یا اوورویتی که بیشتر از BMI متعادل دارن و مشکلات خونی. اینها موارد بسیار مهمی هستش که بر اساس اویدنس های NICE اینها همه جمع آوری شده و ما این فاکتورها رو باید در نظر بگیریم که اگر مادری با این فاکتورها در مراجعات آنتینیتالش بود، ما باید حتما براش یک ساپورت پزشک و مشاور obstetric داشته باشیم. خیلی ممنونم از اینکه ما رو دنبال میکنین، ممنون از اینکه ما رو حمایت میکنین و ما رو تو فیسبوک عضو ما میشین در فیسبوک. لطفاً اگر این کلاس ها مفید بود محبت کنین، با دوستاتون به اشتراک بذارین و در کانال یوتیوب ما لیلی مام سنتر LMC لطفاً عضو بشین، دکمه و اون زنگ عضویت رو بزنین و با دوستاتون به اشتراک بذارین. شبها و روزهای خوبی رو براتون آرزو میکنم، به امید دیدن شادی ها، لبخند و صلح در کنار همدیگه و داشتن زنان توانمند و قوی در کنار شما ماماهای عزیز. دوستتون دارم، شبتون بخیر. Thank you everybody for joining me for today's class. I hope we can come back for next session with the new topics. Please share what you like to talk about, share your comments, share your suggestion, and we are with you. Thank you for all of you. I hope for the peace, love, and powerful midwife and mother for all of the world. Love you. Have a great day, night, and great times. Love you. Good night. Bye. Adios. مع السلامة.